Welcome to the Protecting Your Nest podcast. When I created the NEST acronym, my intent was simply to remind my patients and myself about at least some of the many root causes of chronic medical conditions. But what's interesting is that I always default to thinking about my most precious commodities when I'm thinking about protecting what's in my nest, and that's my two sons. And although my two sons are now young adults, making sure they are okay both physically and emotionally is one of my top priorities. I know that many of you feel the same way, and that's why it's so important that we have some awareness of all the resources our kids may have and to provide those resources as early in their lives as possible. That's why I am so excited that my friend and colleague is here to share how she will be using her book to help make sure you focus on the E in the ROPE acronym, which reminds us to protect our emotions. I only wish I had this great resource when my sons were younger. Today's guest is Dr. Jasmin Searcy-Pate. Dr. Searcy-Pate earned both her graduate degrees, a master's degree, and Doctor of Philosophy in Clinical Psychology from Johns Hopkins University and Jackson State University. In addition, Dr. Searcy-Pate completed specialized training in child pediatric psychology at Children's Hospitals and Clinics of Minnesota and the Department of Defense in Sam Fort Houston, Texas, as a child pediatric health psychologist and credentialed diabetes mental health provider by the American Diabetes Association. She works in collaborations with patients, schools, primary care docs like myself, and of course, specialty providers to provide assessment, therapy, and consultation services. You know, she's doing a great job because she's making her second appearance on the Protecting Your Nest podcast. And I wanted to bring her because she wrote this beautiful book, Olivia Takes a Mental Health Day. And I love the title and I love the color and I love the images. So I'm really excited to talk a little bit about the important topic of mental health, but focusing on the younger population at a time where I feel that sometimes they get overlooked. So with that, Dr. Searcy-Pate, welcome to Protecting Your Nest.
Thank you so much. I'm actually happy to be here because this is one of the most pivotal times when we think about 2022, we think about COVID, and we think about the most recent advisory that was kind of placed by the Surgeon General when we think about children and adolescents, which encourages us as providers and parents and agencies to really put youth at the forefront. So I'm happy to be here. And I just wanted to put that out as we continue to talk. So thank you so much, Dr.
Yeah, thank you for that. And you're right. I think the advisory is important because although we consider children our most precious cargo, we overlook this part of their lives. We just kind of take it for granted. And I think that that advisory is going to help us to focus. So I'm just excited about that. And as you know, we all love the younger people in our lives, and you know we really feel like it's our job to protect them as much as possible. But very few people have taken it to the next step and dedicated their lives to
Right.
helping that younger population. So I'm curious, and I think my listeners are curious now. What led you to focusing on not only taking care of kids, but taking care of their emotional
Yeah,
needs?
to be honest, and just very open and sincere, as a younger child, I actually experienced adverse childhood experiences and actually had a counselor and therapist at a younger age, around 5 years old. At that time, as I got older, I said, you know what? I want to be a therapist or a social worker because I want to help youth. But then I had great mentors during undergraduate experiences. And then I completed a research program called the McNair program while I was an undergrad at Jackson State, who inspired me to really dig deeper into the field of clinical psychologists to specialize in child and adolescent populations. When we think about the stats, it's about 2 to 3% of BIPOC clinical psychologists, right? And so that was really
Mm,
the deciding point for me to say, hey, wow. I'm going to go get my master's, but I'm also going to go on and pursue my doctoral degree to really work with this population. And so, coupled with that and my experiences and my rotations during internship and fellowship, that's when I really decided, wow, this is really what I want to do. This is the missing link. There are not a lot of providers that look like youth, specifically BIPOC youth,
Mm-hmm.
who, when you look at the data and stats now, they're really suffering in the context of COVID. Really before COVID, but in the midst of that, now the rates have really increased. And so to say that in some, I'm so happy that this is the career that I've decided to go into. So,
Yeah, and I'm happy too. Again, I'm primarily taking care of adults in my work now. I'm really a internist, but I trained as a family
yes.
doctor. I do miss those interactions. In fact, whenever patients come to the clinic with their grandbabies, now when it's
Mhm.
possible, I take a moment to
Yes.
engage. I really love that uh,
Yes.
that age and all the positive energy. So you get like an abundance of
Mhm.
that. Obviously, you're dealing with issues when you see them, but their innocence and how they see the world is a little different
Exactly.
than how we see the world. And by the way, shout out to Mississippi. My wife's from Mississippi.
Oh, wow. Yes. Yes,
So
I'm a native.
yeah, I got to do a shout out.
Yes.
That's right.
Yes.
That's awesome. So I definitely want to throw that in
Yes.
there. And but I was curious about one of the things in your intro, which said you were a credentialed diabetes mental health provider with the ADA, and I just want you to kind of briefly just talk about what does that mean?
Yes. So I guess I could start on what does a clinical psychologist do, right? Clinical psychologists, we're a field by itself, right? But we refer to ourselves
Mm-hmm.
as the talking doctors, right? But we also do assessments and evaluations. Well, when we think about clinical psychology and the subspecialties in psychology, I decided to pursue being a child psychologist, which is one subspecialty, and then additionally, a pediatric psychologist, right? So, a pediatric
Mm-hmm.
health psychologist really helps youth who experience or who are diagnosed with chronic medical conditions such as sickle cell disease, diabetes, cancers. One of my specialties in pediatric health is working with youth who've been diagnosed with diabetes. And so that's
Mm-hmm.
one specialty. But aside of that, I really, during training on fellowship, dug a little deeper. And what I decided to do was go an
Mm-hmm.
extra step and complete additional 15 hours of training with medical providers, so endocrinologists, nutritionists, and people who have these specialties in diabetes care. So not only do I know how to help youth who have diabetes, I know about their insulin, their medical supplies, right? Checking numbers. And
Mm-hmm.
it really allows me, I wore the pumps, the different pads, right? And I went through that different
Mm-hmm.
specialty with the American Diabetes Association. And that's something that I have to do every 2 years to keep up that certification to be a licensed credential uh, diabetes provider. On top of that, I've also worked with JDRF, which is the Juvenile Research and Diabetes Foundation, to also hone in on those skills on a national level. So, with the ADA and JDRF, I've been able to really elicit that change in youth who've been diagnosed with diabetes. So,
And maybe a clinical person would know this for sure, but just for those who are listening or watching, we have an
mhm.
epidemic, a pandemic of sorts of obesity, of diabetes in our
Yes,
babies, in our
yes.
kids. And the obesity rate is hovering around 20% for our youth. And that's a huge number, particularly when you think about the fact that the adipocytes, the lipid storing
Mhm,
cells in our body, they are primarily formed before the age of
mhm,
18.
mhm,
So so imagine you have a kid that is dealing with obesity, maybe dealing with diabetes, and by the way, that's going to affect their
mhm.
emotions. So it's important that we have a way to acknowledge that and find a way to help them because it's just a little tougher when you have these. And I consider obesity a disease, and I, of course, consider diabetes a disease. So thank you for that clarification. I'm a big diabetes guy,
Yes,
so
very.
very
Yeah.
much excited to see
And when
that.
I work
Yeah.
with children, they're
So,
so happy, especially my teens and adolescents, for a provider to
hmm
say, hey, not only are you a talking provider, a doctor that I can talk about the adjustment, but I also can say, hey, I know about your Dexcom. I know, tell me about your carb
hmm
counting. I'm
hmm
able to track
right.
along with the behavioral health piece.
That's
Yeah. And so that kind
yeah.
of,
It's value. It's just value added, so I'm so happy you can do that because they kinda sometimes they expect you to know this stuff anyway,
yes,
to be
yes,
honest,
yes,
you know what I
yes,
mean?
yes, yes.
So, it's nice to know it
Yeah.
and, achieve their expectations. So now let's continue as we, talk about your book, and again, it's a book that we smile when we see the color cover, and, Olivia,
Yes.
Taking a Mental Health Day is the title, and I just want to, just talk a little bit about, you know, um, why you felt it would be helpful. You're doing all this great work in the community already, but you decided to take it a little further and write your book. So why did you make that choice?
Yeah, so the why is I figured there was a gap, right? So when you look at the data, I knew there was a gap in helping kids verbalize, right, and express their feelings, their emotions, right? I think about as a child what I would have wanted, right? So that was one thing. I've always wanted to write a book, right? But what really took it further was when Simone Biles took a mental health day last July, August. And that
Mhm,
really, I really had a stopping moment. I said, you know what? I really need to get this out, right? So the why of
mhm,
Olivia Takes a Mental Health Day was really inspired by the narrative of Simone Biles, who's a gymnast, and Olivia is a 9-year-old girl who is an aspiring gymnast, but she also is diagnosed with diabetes type 1 in the story, and she wears her patch, right? She has her medications that she has to take, but she's also having a difficult time expressing and verbalizing what she's feeling, right? And so in the book, I thought it was really helpful to help kids understand the mind and body connection. Oftentimes, when we think about mental health, we're just thinking about our minds, but our bodies are also communicating, right? And sometimes we don't learn the mind and body connection until we're adults, right? So I said, why not allow kids to understand that as young as 5, right? So that they're able to really verbalize and say, wow, here's the connection here as young as 5, all the way up to 14 or whoever wants to read the book. But then the third piece was also when the US Surgeon General really pushed this advisory to the community, to mental health clinicians, to the environment to say, wow, we should really start putting youth mental health as a priority in the context of all of these things that are happening today with COVID and et cetera. So,
and hopefully, you know how our kids that kids influence adults. They influence their parents, they influence their aunts and uncles, they
yes.
influence their grandparents and their siblings, and so if they're talking about mental health, it'll also hopefully trigger adults to talk about mental health,
Absolutely.
not only in their kids, but in themselves, and we can start to socialize talking about this
Right.
topic. And I think that's wonderful. And then speaking of kids and their stressors, I mean, of course, we know kids have stressors like adults. That's for sure. But it's still different in that some of the stressors they experience are different than the ones we experience. So talk a little bit about the stressors that you see in your clinical practice that are common in kids that may not be common in adults.
Yeah. So when we think about development, right, some parents come to see me and say, hey, I don't understand why Jasmine is going through this, right? And I often point to development.
Mhm.
All the things that children or adolescents would want during this stage. They want to socialize, they long to connect with others, right? Put that in the context of COVID, where we've been kind of isolated, right? We are in school, then we're taken out of school, right? We can't go to Jasmine's birthday
Mhm.
party because there's too many kids, right? Or we fear that this is going to happen. That's one layer, right? The social piece. Another layer is kids getting behind academically because of COVID, right? So I see kids who are having difficulties learning or picking up information. I see kids who are also being bullied and teased, whether it's from a racial ethnicity standpoint or bullying or sexual orientation or gender identity and expression standpoint. So we have all of that on top of other stressors in the environment of the family system, right? So parents stressors, right? These kids are dealing with it
Mhm.
all, coupled with everything, and that's why they're coming to see me for anxiety related concerns, depressive related concerns, right? Or just exhaustion, right? Just poor psychosocial adjustment. And these are some of the things, among others, that I've been seeing with kids. Yeah.
And that's insightful. I think, I definitely, watching, even though my kids are young adults now, they definitely, what they experience at school is stressful. Like, we don't always think about it. Just get your homework
Mhm.
done. Well, it's stressful,
Yes.
to have to deal
Yes.
with
Yes.
an assignment literally every day,
Yeah.
every other day is
Yeah.
stressful. Um, it's just stressful. I think about, even in my nutrition and functional medicine training, these quizzes I have on the weekends. It's
Hmm.
stressful.
Hmm.
Uh, it's stressful to, have to turn in that paper on time. And parents just don't, what did Will Smith
Yes.
say?
Yes. Yes.
They just don't
Yeah, and
understand. They
yeah,
just don't
and the
understand.
expectations are different for kids these days, right? That how we grew up, the
Mm,
educational curriculum is different, right? It's
mm,
the expectations
it
are
is.
higher, right? And depending on where you live, kids and math, I looked at my colleague's
Mm.
son's homework the other day. He's 7, and I said, "I'm not sure how to help you with this. This is a different way that I learn," right? And so
At
that was stressful
7.
for me, right? So and how they're teaching, right? And he was actually teaching me how to come up with that, right? It's just a different way, and I think with the
Uh,
curriculum coupled with everything, a lot of stress, right? So, yeah.
yeah, it's very stressful, and you're right. It's a little, there are I when we were looking at our kids going to college, we did do a lot of research, and we did find, so I was like, well, we got them at Providence St. Mel's, a great school on the west side of Chicago, kind of in the middle of the, hood in a way,
Yes.
but it was a great school, great story
Yeah.
behind that school. But then what we notice is that, do they have to go to a top 20 school? Does it matter? And the reality is, not necessarily, but for the demographic of African American male, believe it or not, it did matter
Mhm,
more
mhm,
for some
mhm,
reason, where it didn't matter as much as people think for other demographics.
mhm.
So you have to weigh all of these, but do you really want to spend all of this energy stressing them out about their ACT scores and
Yes,
all of these
yes,
things they have to
yeah,
do? And the answer is not
yeah,
really. So I just want to live in a world where we can think bigger than that.
mhm,
And I know some of the top schools are already moving away from
mhm,
those types of things. So
mhm.
it's just very interesting to hear your thoughts on that. So
And like
so I also know that,
yeah, I was
yeah,
gonna say that's a good point because a lot of my teams, in the city of Chicago, I've been fortunate where all of my teams are going to the bigger name schools, right? So at 16, 17, and even 15, they're in AP courses, they're already preparing to go to these top schools. And I'm like, wow, I have to reflect. Like, this is a lot. I can see. But what I try to talk to them is, let's get through it. We can't change this, right? I hear your
right,
goals, I hear
that's
your
right.
passions. We can't change this, but let's look at it a different way from a mental health standpoint. So
Hmm.
I just wanted to
I like
add that.
that. I like that. So thank you for that. I could only imagine that, you know, trying to identify kids who suffer emotionally or are having mental challenges can be difficult. Maybe not so much for
Mhm,
you because this is what you do, right? But that could be a challenge for a parent. And when you add to the fact that, maybe there's a little
mhm,
denial, that, oh, my kid's fine. There's nothing wrong with them. So I think there's two questions here. as a parent who's listening to this episode, what should they be looking for to help understand when their kids may be struggling emotionally? And is there a way to overcome that denial tendency that because we want our little precious,
Mhm,
Jules to be
mhm,
perfect and
mhm,
not suffering and not, deficient or
mhm.
anything like that. So how do we overcome those? How do we
Yeah,
deal with
those are
that?
great questions. I would say the first question that you asked or pose changes, right? So when we think about children and parents saying, wow, how would I know if Jasmine needs assistance, right?
Mm-hmm.
From a mental health standpoint, the first thing I say, just like adults, is look for changes in overall level of
Mm-hmm.
functioning. So, concentration, mood. Is Jasmine more irritable, right? Appetite, right? Are they isolating? A lot of teens like to stay by themselves, right? Are they more tearful, right? Younger kids, they're more irritable, they're more tearful, they're more clingy, right? Teens are the ones who really
Mm-hmm.
isolate or just doesn't want to talk. They stay in their room, right? I would say look for changes in all domains, right? From the home setting, school setting, as well as personal setting for youth, right? From ages 3 to 17. Now, youth compared to adults were able to say when something's wrong most of the time. Not all adults, right? Because some of us don't have the insight. But youth, not so much, right? It typically takes caregivers or their friends or someone to say, hey, Jasmine, you seem more moody than usual. Is something up, right? Or I haven't seen you come out your room all day, right? For the past week, right? I think when you start to see those changes among others, that's a signal internally for parents to say, possibly we can reach out to someone for support or to consult to see if Dr. So and so or going to talk to a counselor may be helpful for Jasmine, right? And our family, so we can learn ways to work with Jasmine or help Jasmine get over these things, right? I also, as a parent, would stay abreast with the school, her grades. I would check in with the teachers as needed, depending on the child's age or your youth's age, to kind of figure out what they are seeing so that everyone could be on board if something is
Mm-hmm.
off from that
Mm-hmm.
standpoint. Now, parents, okay, that's a different thing, right? Like, what do we do? What if we're in denial? I do work with parents who are in denial, right? I initially, most kids when they see me, some teens they'll start off like, I don't want to see you. And then once I kick parents out, they load everything, right? Once they see that this
Mm-hmm.
is all about us, unless parents need to be involved every session, then they really are able to verbalize that something is off and then we go from there. But when I meet with parents, what I typically say is, I hear you, and I'm going to normalize that you may not see or think anything is wrong. But let me ask you a question. When you were younger, how did you communicate to your parents, right, or loved ones that something was off? Walk me through that. And sometimes parents are able to verbalize, but also they may say, well, yeah, things were wrong with me, but I got through it, right? Look at me. I got through it,
Mm-hmm.
but I always say like what walk me through what did it cost? What did that look like getting through it, right? Would have been helpful for you to talk to someone to really process whatever you were going through in a safe space. Why not give Jasmine that opportunity, right? And so some parents are then open to that conversation. And then some
Mm-hmm.
say, I don't want to talk about this. It's getting me in my feelings. Work with Jasmine, and then we'll talk about it later. Right. And so that's totally fine too. And then we go from there. So, yeah. Mm,
That's cool.
yeah.
So all parents are different, all kids are
Mhm,
different. And so you kind of go through this problem solving experiment to figure out what's the
mhm,
best
mhm,
approach for each kid and each parent. So that's
mhm,
that's that's really helpful and makes a lot of sense. So um, I know that you know we all need breaks. You talked a little bit about our Olympic superstar taking a break. We know one of our star tennis players took a
yes.
break, and it's so important that we have emotional restoration. And I think about yourself and myself. We're busy clinicians, and we need to also be restored. So what we did as a family, unfortunately, basketball messed it up when they were younger, because when you start playing basketball, your weekends are shot.
Yeah.
You're pretty much
You're going every
going to
weekend.
tournaments
Yes,
and
yes.
every weekend. But before that, we actually would take a Friday through a Sunday, and sometimes, Friday afternoon through Sunday, and just get in a car and just go somewhere, that would it could be somewhere as close as, to the Wisconsin Dells, which is not far from Chicago, or the Cays in
Mhm.
Kentucky. But we would take a trip, and it was something we did every 2 to 3 months. So it gave us something to not only look forward to, but it felt like a mental
Mhm.
break, not only for the parents, but as I reflect back, I'm sure it was a mental break for our kids. And when I thought about our conversation, I was able to see that in January of 2019 in Oregon, they passed a bill that allowed for mental health days for our kids, and they were doing the same kind of work in California and
Mhm.
Colorado, to have similar legislation. So just talk a little bit more about why it's so important to have a mental health day, a day to just take a
Mhm.
break,
Mhm.
to kind of recover. Why is that so important?
Yeah, great. Mental health, when we think about the term, is obviously protecting our temples. If you're coming from it from a spiritual aspect, if you think about it, our minds, our bodies, our overall wellness, right? And so when you think about the body, this is biological. We need to recover, right? Because they communicate. The mind and body, there's a connection. There, it's backed by data, right? But taking a mental health day is just, some people, when they think about it, they think about it as taking a day off and you're just doing it, right? I would say be intentional about taking a mental health day. So I take sabbaticals, which is a time period where you do nothing, right? So for me, beginning last year, I took a sabbatical of about 6 weeks. And then I took another sabbatical about 2 weeks to focus on recovering, to reduce stress levels, to take care of my temple. I worked out, I ate foods, right? At least 90% there, uh, thinking about diet and exercise because I needed a moment to recover. Now, I know everyone may not be able to do that, but that's my commitment. But it's really important, no matter if you're 3 years old, all the way to 85 and up, right? You need time to kind of to reflect and take a step back to say, wait a minute, what am I doing here? Let me reflect. Let me look at my stress levels and kind of just calm down, whatever works for you, right? So that you can take care of your mind and body. And it gives us time to kind of reflect on what's happening in the moment because in life, we're busy. You're a clinician, Dr. Hampton. I am too. Unfortunately, there are things we just can't get out of as clinicians, right?
Mm-mm.
And in life, no matter what role you have, you may also experience that, but even taking a mental health day is taking half the day to reflect on those things, even if something is not wrong, right? It just allows you to reflect,
Mhm.
to
Mhm.
recover, and focus on your nest, as well as those dimensions of wellness, as mentioned by SAMHSA. So,
Wow. I do reflect back again on those 3-day weekends, but man, you said 6
mhm.
weeks, so we have some work to do, and I could imagine what that would feel like to find a way to separate yourself from all the things that keep you
Yeah,
busy,
and it's
that
interesting
create some stress in your
yeah,
life.
it's interesting you say that. So my sabbatical of 6 weeks is not seeing patient care, but guess what I was doing the 6 weeks of last year? Writing Olivia, which is something that made me so happy. Yeah, because that was my give back. It was serving, which is something that I
Yeah.
hadn't been able to do. I mean, I've seen patients I served that way, but really focus on something, birth a baby, right? When you think about it, that would
Yeah.
influence others, right, in the near future. So, yeah, but I did not.
And that's
Yeah.
but that's cool,
Mhm,
though. That's cool because for some of us, writing or reading is
mhm,
not
mhm,
stressful. It's actually a way to
mhm.
relax. So, that I'm sure there's parts of that when you're editing or something that becomes like that. But I'm telling you that makes sense to me. That definitely resonates with me. So I'm happy that you birthed
Mhm, mhm.
this wonderful book. Um, One thing that I want to briefly touch on is the pandemic and its impact. Clearly, it's had a tremendous impact on many of my patients, and rather it's because they've are been exposed, they're recovering from coronavirus, or just simply the isolation. But not often do we talk about our children and the impact it's had on them. So since you've been living in this pandemic for over the last 2 years, you've seen a lot of kids that have been going through the same thing. And what are you seeing in terms of the impact the pandemic has had on them?
Right. I think the biggest impact across the span, ages 3 all the way to 26 in my practice, but let's focus on children, 3 to 17, mostly poor concentration, executive functioning, difficulty, especially when you think about the transition from being at home and doing things at your own pace to now being back at school. And now the bar has been raised. But I also see
Hmm.
or have seen that they were so excited to get out the home. So when you work with children, virtual is non-existent. You can do it, but with children, they like to see, they like to feel. So coming to see me was an outlet
Hmm.
for them. They were so comfortable,
Hmm.
even though I was managing depressive and anxiety related symptoms, right? So some kids,
Hmm.
if they presented with generalized anxiety disorder symptoms, their symptoms kind of increased as a result of the COVID pandemic. So, for example, they worried more.
Hmm.
They worried about getting COVID. They worried about losing their parents. They complained more of tummy aches, right? If I had a child who I was previously working with for depression or depressive related symptoms, their symptoms also went up. Even if it was, I can't connect with my friends, I can't see anyone, right? Which is that social piece that is very important. And also testing, right? So, from a testing standpoint, as a psychologist, I do assessments and evaluations. I had a flux of referrals for, does my kid have ADHD or a learning disability? Because when you think about the
Hmm.
pandemic, a lot of kids were staying at home. It's not that they have these diagnoses, right? It's just, I think the teaching, the curriculum just kind of got behind because of the virtual format as well. So,
Hmm.
yep.
Okay, cool,
Hmm.
cool. And and again, that's why again, resources, you're a
Hmm.
resource by being available to them, or their parents will always be a resource. But again, a beautiful book
Hmm.
that'll put things in
Hmm.
perspective is a great resource
Mhm.
as you're taking a six
Yes.
week
Yes,
break
absolutely.
and creating it, which is
Yeah.
amazing. So, but when I first saw the image of the cover. At first, I just felt proud because I got to know you as we share talking points with Danny Davis's couch conversation with the doctors. So shout out to that
Yes.
crew, all our doctor colleagues, Danny Davis, Nikki, who hosted, Dr. Pete and Dr. Graham, and all the others who are there um, with us. But I looked at that image and I said, man, that's a beautiful girl of color, very striking. And then I saw you share some of the images of the parents,
Yes.
and I noticed that the parents seem very diverse themselves.
Mhm.
So I'm curious, when you made the decision to diversify the parents, the young lady who's the featured star of the book, what were you thinking about when you made those choices?
Yes, that's a great question. So I actually have the book for listeners right here. And so when I thought of Olivia, really Olivia, the character represents me as a child. I love gymnastics, right? So I thought of her, but when you think about the why, I knew I wanted this book to be
Hmm.
for BIPOC families. That was the narrative right there. I knew
Mm.
I wanted it to be diverse. I wanted characters who identified as African American or Black or Caribbean or of Asian descent, right?
Hmm.
Or Latinx, right? I knew I wanted every representation in the book. So I was very diligent with my illustrator. I was like, Anita, she has to do this. I need barrettes. I need glasses.
Mhm.
I was very detailed on how the features of the kids looked in the book because I wanted children, no matter what color, race, ethnicity, to pick up the book and say, wow, it's everybody in the book. Look, look, right? And
Right,
that to be and
right.
which has happened. So all my clientele, they look at the book and they're like, "Wow, what's that book?" As soon as they walk in, and they're able to talk about the different characteristics in each character in the book who are all different. Even the parents, right? Parents are interracial
Yep,
couples in the book. Their noses are
that's
defined
right.
from a Native
That's
American
right.
standpoint to African American, Latinx, and all across the board. So I knew that had to be an important piece because when we think about mental health in BIPOC communities, we don't talk about it as much. So that's another goal to really push that narrative by this book and getting the word out there. So, mhm.
Man,
Yeah.
I think about my older brother. My older brother used to tease me, "So you got a big nose."
Mhm.
I said, "Uh-huh."
Yes, yes, yes.
And the thing is and I'm like, "Yeah, but guess what? I need to be proud of who Tony
Yes,
is,
yes.
right?" So, and I want all these
Mhm,
babies, these children, these young adults, I want them to be celebrate what makes you
yeah.
different, and that's why, again, and it shouldn't be so dramatic for your clients to walk in and be so
Mhm,
amazed to see what they
mhm,
saw, and that's why this work is so important. It should be
mhm,
normal one
mhm,
day, and right now it's not
mhm.
normal. So we want to make it normal, but we're gonna not just honor African American kids. We're honoring
Yep.
all our diversities. I think we're all in a position to bring value, and I just love the fact that you were thoughtful
Mhm,
about
mhm,
that. And one of the things that I think about when I think about how important this is because so many in the communities of color are
mhm,
vulnerable uh, to
mhm,
emotional health being not what it should
mhm,
be. So we want to make sure that the communities all over the world are able to hear this message, but we definitely want to make sure the
mhm.
vulnerable communities too, are able to hear the message. So when you think about that, you know, why do you think it's so important to put that message out there that yes, there are people who are more likely to suffer emotionally in certain communities? What do you think about that concept?
Yeah, I do think that there are more people or populations who thinking about emotional health, mental health, i.e., suffer more than others. So the data doesn't it's out there,
Mm-hmm.
right? And I
Mm-hmm.
also thought again, like you said, the book, the representation. I had a lunch party yesterday and 3 of the girls just looked at the book. I didn't know them, and they said, "Wow, there's a girl that looked like me." You know how proud I
Mm,
was, right? To hear that,
mm,
but also asking questions to all of the kids in there who represented about 80% BIPOC communities, right? Who said mental health is so important. They were able to verbalize what mental health was as young as 3 all the way to
mhm,
12. So that was important. But
mm,
also, and I'm hoping that I'm answering your question, representation is important, right? Because now it's really
mhm,
normalizing the narrative that mental health is normal. We're going to talk about it. Representation matters, right? And number 3, I experience all these different types of emotions. I don't know what to do with them, but I know that I'm going to verbalize and communicate to my loved ones, whether that's mommy or daddy or my aunt or uncle, to
mhm.
say, perhaps I need to go talk to a Dr. Jazz, right, about what I'm experiencing. So
Mm.
hopefully I was able to answer that. Yes. So,
You
mhm,
were, and for all the parents out there, even before you, get Dr. Jasmine's beautiful book, listen, to your children. Let them you may have already decided in your mind what your
mhm,
response is, but if you listen to them every once in a while, they'll throw a nugget
mhm,
at you that'll make you question maybe the direction you were going in. They're just little adults and they have an opinion and they have things that they may be able to share that may help us as we try to parent them. So please pause and listen to your babies because they are filled with so much that can help you do your job. It's just like as a leader, I like to let my teams help me do the job
Mhm.
of being a leader.
Mhm.
Much harder to just think I know
Mhm.
everything.
Mhm.
I don't know
Yeah.
everything, so I think it's a similar concept. I'm also thinking about my previous guest, Dr. Fatima Cody Stanford, who is at Harvard, and she shared something that was striking during a previous podcast, and what she shared was that the capacity for little people,
Mhm.
to be biased towards others starts at 32 months of
Mhm.
age.
Mhm.
And I was like,
Yep.
wow,
Yep.
right? And you probably knew that
Yep.
already. And it was amazing to me to think that that
Yeah.
was true. And so having said that, I'm also imagining that if that's true, then maybe it's possible for a child, to feel what it's like to be stigmatized, to have stigma towards them,
Mhm.
particularly if they are expressing that they have some
Mhm.
emotional
Mhm.
issues, right? And so I'm curious from your perspective, is it true that at these young ages they can feel
Yeah.
stigma? And is that so? It can come from them, and I'm assuming it can come from the parents too, obviously, because they're going to feel it
Mhm.
because based on what we talked about earlier. But so, what's your thoughts on that? Talk a
Yeah,
little bit about that.
kids feel, okay? They can feel depending on their temperament and personality. I do agree with your colleague. I see children as young as 4 for therapy, where we're doing either cognitive behavioral therapy or play therapy because of their age. And they will reveal so many things with me, right? Through their play, talking about their worries, right? All the way to teens. And I'll say, you know what? Jasmine, that was really good information. I'm wondering, can we share this with mom or dad? Shh,
Mm-hmm.
no, I don't want them to know
Mm.
that, right? And so when I explore that, of
Mm-mm.
course, that's not a safety concern, right? They have to teach me. They were like, well, I know if I talk about A, B, C, or D, mama's going to cry or she's going to say, we don't,
Mm.
get over this, right? Or say different things, right? Or that bias that causes sometimes children to shut down and not be as open, right? So, my hope and
Mhm.
wish during that time is oftentimes I'll pull parents to the side. And just like you said, Dr. Hampton, I'll say, won't you spend about 20 minutes a day doing special time with Jasmine, no matter if they're 3, as young as 14, and you're just observing and listening to them. And they're guiding that
Mhm.
interaction or play, whatever they're doing, and just listen. Don't offer opinions, don't try to fix a situation. Just listen and use those listening skills to listen and provide that safe space so that children are able to be open, right, to those interactions and talk about their emotions, their thoughts, their feelings, and anything that may come up for them, right? Because it will be my
Mm.
hope that, yeah, they come see Dr. Jasmine, right? But they don't see me forever. So my hope is that once
Mhm.
they graduate, they're able to go back to into the home setting and be able to integrate, and the family and caregivers are able to talk about, verbalize, and be able to help them over those humps that they may experience throughout life. Yeah. But yes, kids are they can be biased. They know more parents than we realize as young as 3 and 4 years
Right.
old. If they're not able to verbalize, Dr. Hampton, they draw me pictures. They do play. You can find a lot of
Mm.
things in their play, whether it's their worries or what's happening in the home or what mommy is saying and daddy is saying that come up, and they know more than what we think they know. So,
Wow. I sometimes when you're talking, I can hear some of the southern
yes, yes,
parts of your
yes, yes.
and I only bring that up because I think about how in certain cultures how we raise our
Mhm,
kids and the discipline can be
mhm,
pretty
mhm,
intense, right? And then I'm thinking about the parent who's on the extreme where they're trying to be like friends,
mhm.
right? So you got this one extreme, which is how a lot of us were raised, where it is what it is. I'm running this,
Yes,
and you do what I
yes.
say. and don't have me go get that
Yes,
switch.
yes,
And then you have this other extreme where you want to be like buddy
yes.
buddy. And I think that's very difficult for parents because when you're dealing with emotional things, it's going to require that you really balance that somehow, where you're still being a parent, but you're able to listen and to hear the child and to be present. So I just think that that's why, again, the resource of having a book to start the
Hmm.
conversation is going to be really valuable. And I think that's why all of those who are listening, whether it's your grandchild, your net, the little nieces, I think this is a great way to bless them and their parents, if you're not the parent, with a tool that'll help them be emotionally healthy. So I love that. I also know, because I'm the metabolic doc,
Hmm.
the low carb doc, that I know there's a lot of things beyond the work you do that will help keep our babies healthy. So when you're talking to, clearly you have diabetes expertise, but what other things do you say to families to keep them emotionally healthy beyond the conversations you have?
Okay. To keep them emotionally talk to each other, communicate, be present in the moment, right? Um, let's not be so quick to respond, right? But to love on each other, right?
Mhm.
um, let's
Mhm.
provide a safe environment for each other. So, safe hands, safe words where it's
Mm.
not emotionally
Mhm.
abusive, right? Or emotional damage there, right? Because there are different
Mhm.
forms. Thinking about families, we have this term called intergenerational traumas. If you've seen the movie
Mhm.
Encanto, that's a
Mm.
perfect example. And we want to stop that narrative to some degree, right? And
Mm.
promote that unity in families, right? So, aside of children coming to see me talking about mental health concerns, I also advise parents and children and teens to talk to each other, love on each other, right? To
Mhm.
reflect, right? To not,
Mhm.
use nice words, use safe hands, right? As I mentioned to my families, and
Mhm.
those are some things that I'll leave them with in general, right? So they can move forward. And I always say,
Okay.
as Frederick Douglass said, it's easier to really work with children than to repair broken men or adults, right? So it's easier to
Mm. Mm.
really help children so that when they become adults, because they're going to experience some emotional, they're going to experience stressors. I mean, think about our careers, but if we have the tools and coping strategies in our toolkit, as adults, we're able to dig back in there and use those same skills as a reminder to take care of ourselves and mental health. So,
Absolutely. Just it's almost like here's your purpose statement. This is the overall way we want to approach life,
mhm.
and here's some basic philosophies on how to do it. And I do want to say, from my perspective, I just want to make sure that parents understand, as you work on your self improvement for 2022. And you may make dietary changes, understand that almost everybody in my practice who makes dietary changes are become more healthy
Yes,
emotionally. So it's not just for you, your babies
yes,
should be eating
yes,
better as
yes,
well, and then they will be more stable prior to going to school if you give them the right kind of
yes.
nutrition. So I think that's going to be important as
That's one
well.
of the biggest conversations. Is It's really interesting you say that. When I was in clinics for children who were diagnosed with prediabetes or type 2, one of
Hmm.
the things I used to remind parents is when, Jasmine's looking at you. So whatever you are cooking and serving and your lifestyle trickles down to the kids, right? So if you're doing
Hmm.
better
That's
and you're
right.
leading the household, it's going to trickle down to Jasmine, the brothers, everybody in the household, right? And so it's
Hmm.
just, I just wanted to add that statement, right? So,
Absolutely. I think that's great. So, as it relates to Dr. Jasmine,
mm,
the older version,
yes, yes,
so when it comes to you, and you're going to be busy, you're going to be busy in high demand as you share this wonderful work. Um, so you're going to have to really be thinking about the things that you've already shared, how you kind of protect your nest. So what are you thinking about focusing on yourself for 2022 to make sure you're healthy? So at the end of all of this, you'll still be whole.
That's good that you said that. On my vision board, I create a vision board with my husband every December 31st, right into the new year. And what I have to protect my nest from an emotional standpoint is taking a week out of a month with no patient care,
Mm-hmm.
no patient care at all.
Mm,
Okay. And so I've removed myself for a week out of a month to doing nothing related to patient care and taking care of others.
mm-hmm.
And I think for me, that's going to, I love my work, but sometimes you can have good sources of stress, right? Which is the work that I do
Mm,
and work we do. And I think taking that week can allow me to focus on my mental health and just kind of take a step back to make sure that I'm aware of what's going on within me, and then move forward for the next month. But that's what I will be doing each month. Yeah. Mhm.
that's perfect. So definitely do that. We want to keep you around,
Yes.
and I think that yeah, we gotta get this message out, and we need more clinicians like yourself who spend a little extra time to create ways for people to walk towards I call it metabolic
Mhm.
health, and that includes all the things. And again, that's why the rope has an E for emotions, to remind us to protect our emotions. So I'm really happy and excited. You're only the second person I think I've had on twice so far, so you're in a elite group,
Ooh.
just so you know. And that's right. And I just felt it was really important. I know your book at the time of our recording and release will still be in pre-sale, but let's talk a little bit about how people can connect with you and obviously get this wonderful book for their family.
Absolutely. So yesterday I had my book lunch and read. The book will be in Spanish within the next 4 to 6 weeks. So it will be in English and Spanish version. Currently, it's on pre-order status. So right now it's in about 30 plus retailers, including Amazon. Most people have Amazon account or Amazon Prime, so you can look for the
Hmm.
title Olivia Takes a Mental Health Day or type in my name and you'll find me under the book. Because it's in pre order status, the book picture is still being populated, but it should be
Hmm.
sent to you by March 3rd. Also, I have a website. So I have a lot of people who say, I cannot wait. I want a signed copy. I do signed copies as well as write personal notes for individuals, especially my parents who say, hey, can you autograph this and write a note to Jasmine
Hmm.
or Tony, little Tony Jr., right? And so I do that
That's right.
through my personal website, which is www.searcypediatrics.org, and there's a retail tab and you can order it and it comes to you in less than 5 days, yeah, through that way. So
Awesome. Love it. And again, I am
yes.
excited. I'm very happy that you are. I remember what it felt like to write a book and to put it out there. And it's one of those things you think you'd never
Mhm.
do. You talk about doing it, but you never do
Right.
it. And so to finally do that, and for some people, that leads to more. So,
Mhm.
not to put the pressure on you, but I'm looking forward to, the work you're going to be doing in the future. And I really want to thank you again
Absolutely.
for joining me on protecting your nest. So thanks again, Doc.
Absolutely a pleasure, and anytime. So I enjoyed it. So
All right. All right. Appreciate you. So again, today, guys, we focused on, our most precious cargo, our children. And we really haven't had a lot of episodes where we've done that. So I'm just
yeah,
thankful
let's start it.
that
Let's
today's
let me
let's
yeah.
do it. We don't want to.
Yes.
Don't worry, and we know who to go to,
Yes.
right? And so it's the reminder that all of those struggles that kids are going through, whether it's our children, our nieces, our nephews, our grandkids. It's nice to know that we will give them the attention they deserve. So now we have something we can expose them to, and that's Dr. Searcy-Pate's beautifully written and illustrated book. And with that, I think we'll all be better prepared, not only to talk about mental health in that age group, but to approach it in a supportive and non-stigmatizing
Yeah.
way. We now have tools, guys, so we have no excuse but to take advantage of it. So make sure that you share Dr. Jasmine's book with that special someone that you have in your life. And that'll not only help protect their personal nest, but it'll help the whole family, because we do focus on our children and we want them to be successful. So I really hope this discussion has enlightened you and reminded you that supporting our younger children is so important. It's a generational thing, and we want to kind of make sure each
Right.
generation is healthy. So rather you, and let's go even beyond the book, rather you want to get in front of that child and share words, a hug, a
Mhm.
kiss, uh, or maybe even a book.
Yeah.
Make sure you do that as soon as you get off of this
Mhm.
recording. Go find somebody in your life that you love who needs to get that hug or kiss, and it'll be a blessing not only to them, but it'll be a blessing to you. So Doc, again, we appreciate you for being here. And as we wrap up this edition of Protecting Your Nest, I only ask that everybody who's here with us today to continue to be safe, be well, and continue to protect your nest. And thanks again, Doc.
Absolutely.